H5N1, highly pathogenic avian influenza, has caused infections in poultry in more than 60 countries since 2003 and is a severe threat to poultry production, human health, and the world economy. Influenza experts are concerned this virus could lead to the next human influenza pandemic. Planning for the control of H5N1 in poultry and minimizing the potential of a pandemic influenza in people is essential for safeguarding human health, food production, and social stability. Control strategies for this disease include biosecurity, surveillance, animal movement control, education, and vaccination. Vaccination of poultry can be a very valuable tool in the control of H5N1 avian influenza, but it is costly and requires a carefully planned and implemented program. The experts agree that vaccination should be used as little as possible and must be targeted to the population most at risk. Vaccination cannot be used alone. Other management controls and biosecurity measures must be implemented as well. This video is about developing and managing vaccination programs to control H5N1 in poultry once the decision to vaccinate has been made. The target audience is officials who will manage and individuals who will carry out the vaccination program. First, we will discuss how vaccination is used, the importance of a vaccination plan, and components of the plan that must be in place prior to beginning a vaccination program. Next, we will cover the role of government veterinary services, the poultry industry, and community leaders in the campaign. Then we will discuss how to implement the campaign, vaccination procedures for avian influenza, and the importance of monitoring programs to ensure that vaccination is effective. Before getting into details about developing and managing a vaccination program for avian influenza, we will discuss the 3 situations where vaccination is used. In an emergency situation, vaccination is used to create a buffer zone in the area most at risk. It is often implemented as a ring in a defined area around an outbreak to prevent the virus from spreading further and to protect the environment around the outbreak. In emergency vaccination, infected flocks must be destroyed, movement controls must be imposed, and biosecurity, cleaning, and disinfection practices must be implemented to ensure that the program will be successful. Preventive or targeted vaccination is used when a country or region faces a significant risk of avian influenza introduction. This strategy should be considered if the risk assessment shows that other tools are unlikely to control the disease and that response measures cannot be implemented quickly enough to prevent further spread. In this case, only defined categories of birds, selected on the basis of risk analysis, are vaccinated. Preventive vaccination may also be used when limited vaccine stocks are available, or to establish subpopulations of disease-free animals for trade purposes. Routine or mass vaccination can be used in countries and regions where the disease is endemic and where other control measures cannot eliminate the virus. The primary goal of this strategy can be to protect livelihoods, reduce economic losses due to mortality and morbidity, and reduce human exposure. This strategy can be valuable in reducing mortality and production loss. However, it is costly to maintain. In the long term, routine vaccination can decrease the prevalence of infection to a level where stamping out and surveillance could be used to eradicate the disease. The logistics of using vaccination in these 3 situations are quite different. How vaccination will be used must be considered as the vaccination plan is being developed and as resources for vaccination are requested and secured. The World Organization for Animal Health, the OIE, and the Food and Agriculture Organization, the FAO, recommend that all countries develop a national plan for H5N1 avian influenza. The vaccination plan is one component of the national plan, and both should be developed before an outbreak occurs. The vaccination plan should include details on the logistical, personnel, and financial resources needed. The more information in the plan, the better prepared those who are charged with managing and carrying out the vaccination plan will be.
but national plans and developing strategies that have to be jointly developed and tailored specifically to the type of government, the structure of the industry, the agricultural practices, the terrain, and cater to the nuances and regional differences even within a country, including those traditions that have been practiced for millennia.
Who creates and contributes to the vaccination plan? The veterinary services should take the leadership role in development of the vaccination plan. Various government agencies and the poultry industry should be involved. Agencies with responsibilities related to vaccination include agriculture, to help veterinary services staff administer the program, assist with record keeping, and communicating with other agriculture sectors that may be affected by vaccination. Finance, to provide funding to purchase vaccines and supplies. Transportation, to ensure that vaccines and supplies reach their destination and are properly maintained. Public safety, to enforce stop movement and quarantine orders. Commerce, to discuss the vaccination plan with trading partners. Public health, for producer and consumer education and to minimize the potential for human infection. The poultry industry needs to be involved in the development of the vaccination plan. Industry acceptance is needed for the program to be successful. The industry can help to ensure that all susceptible animals will be vaccinated and that accurate records will be kept for surveillance. The industry may also be able to provide important resources that will contribute to the success of the program. For example, employees or equipment may be contributed to help vaccinate backyard flocks. In addition, other livestock sectors should be included in development of the plan if they will be affected by stop movement orders and trade barriers. The plan should take into account target species such as chickens, ducks, or other birds, various sectors of poultry production, different levels of biosecurity ranging from backyard birds to commercially raised birds in high biosecurity enclosed buildings, culling, movement restrictions. The vaccination plan should include the objectives should include the vaccination rate you hope to achieve, for example, 80% of eligible birds, and the number of chickens, ducks, or other birds to be vaccinated. Also, objectives for monitoring, record keeping, and protection of human health should be included. The plan should include guidelines on how long the vaccination program will last.
And what are the signals for stopping vaccination? So when are your review points? And what is your exit strategy? Now, your exit strategy may be many years away, especially in endemically infected countries. But at least you have to have some sort of review points along the way to say, well, this is when we're going to review our vaccination and the need for continuing vaccination, whether we need to continue vaccinating all of our original target population or whether we can stop vaccinating certain sectors of the poultry population.
The plan should include the geographic areas and the sectors to be covered by vaccination and must be flexible enough to adapt as the situation changes. The sectors can range from highly industrialized production units to backyard poultry.
In administration, you must know the species of bird that the vaccine will be used in and the length of life for those individual production birds. This will impact the number of doses of vaccine that each bird will need in order to produce protective immunity. For example, in ducks and geese, there's a minimum of 2 doses to produce sufficient immunity to last for their lifetime.
Vaccinators need to be trained to inject the vaccines, to use and store the vaccines, to use personal protective equipment, and to keep records. It is best to conduct training prior to an outbreak. Plans for an adequate supply of syringes, needles, cold storage equipment, personal protective equipment, and cleaning and disinfection equipment should be made. A plan to distribute these supplies to the vaccinators is also needed. A plan for delivery of vaccines, maintaining the cold chain, and the schedule for vaccination in each area should be developed and tested if possible. A budget for the vaccination program should be developed in advance and sources of funding for the campaign should be identified. Who will pay for the vaccines and vaccination? The public sector? The private sector? Will vaccination be partially subsidized? A monitoring and surveillance program is an essential component of vaccination. Plans to monitor the effectiveness of the vaccination program, the effectiveness of the vaccine itself, and changes in the virus circulating in the field must be in place prior to vaccination. Plans should address who will collect and ship the samples, and where the samples will be shipped for testing. A record-keeping, reporting, and communication program should be developed and tested. Effective laws must be in place to implement vaccination and other HPAI control measures. Veterinary services should work with the legislative branch of the country to ensure that laws that support mandatory vaccination, movement controls, quarantines, surveillance, and biosecurity have been passed. Legal authority is also needed for culling of infected poultry and payment of compensation for birds that are destroyed. Compensation will influence producers' willingness to notify authorities of disease outbreaks. Compensation also impacts the decision to vaccinate.
Farmers have to be paid quickly in the right amount. One cannot pay too much or too little, or the compensation becomes a problem rather than contributing to the solution.
The challenges of developing an effective vaccination plan are developing a plan that will provide the foundation for an effective response and that will be flexible enough to meet changing situations, addressing logistical issues before an outbreak occurs, involving those familiar with the poultry industry, factoring in cultural practices associated with poultry, enlisting the support of other agencies within the government for the plan. The OIE, the FAO, and countries that have used vaccination to control avian influenza can provide additional advice and first-hand experience on the development of the vaccination plan and how it can enhance the response to an incursion of H5N1. Vaccination for avian influenza is more complex than that for other animal diseases. Influenza viruses mutate rapidly, and mutation may make the vaccine less effective. H5N1 vaccines do not always protect birds. There are many strains of H5N1 virus, and the vaccine strain must match the field strain of the virus to be effective. Most vaccines have only been tested in commercial chickens and may not work in waterfowl and native chickens. Concurrent infection with other viruses or other health problems may inhibit the vaccine from working. There are different types of vaccines for highly pathogenic avian influenza, and each has its advantages and disadvantages. Experts should be consulted for assistance in selecting the best vaccine for each situation. Vaccination of birds can prevent illness, but does not prevent infection. Vaccination makes detection of infected birds more difficult. A system must be in place to detect vaccinated birds that become infected. Despite these complexities, the use of vaccine as part of an organized avian influenza control program has usually been successful in reducing disease transmission. Selection of the best vaccine for each situation is very important. Before selecting the vaccine strain, the hemagglutinin H type of the currently circulating field strain or the virus that is expected to be introduced into the country should be known. The hemagglutinin should be homologous between field and vaccine strain. This is the most important part of the virus for inducing immunity. The vaccine should be selected based on evidence that it significantly reduces virus excretion from vaccinated birds. Many avian influenza vaccines are available. A country should only use a high-quality vaccine produced according to World Organization for Animal Health Quality Standards and licensed by the national licensing authorities. The OIE has standards for vaccines at this website.
A few words on field application, which unfortunately is very often overlooked. and instead is one of the biggest problems that you have in implementing a vaccination campaign. One thing is vaccinating birds in the laboratory, and one thing is vaccinating them in the field. Compliance is always lower in the field to what it is under experimental conditions. We have issues of storage of vaccine, of blending the vaccine with other vaccines, and so on. And of course, there are some immunosuppressive diseases that can influence the immune response to the vaccine. And also, there is a lot of work that still needs to be done to identify the most efficient vaccination programs.
The challenges of choosing a vaccine are selecting the most appropriate vaccine to match the field strain, ensuring that it is of high quality, monitoring the effectiveness of vaccines and vaccine administration. Another challenge is having immediate access to good quality vaccines when needed. The overall effectiveness of avian influenza vaccination is related to the time span between the first cases and vaccine administration. The sooner vaccination is started, the better. Most biologic companies need at least 10 to 12 weeks to produce and test an avian influenza vaccine. The disease can spread widely in that time. The number of doses held by most biologics companies at any given time may not be sufficient for areas of dense poultry populations. For this reason, countries at high risk should consider establishing a vaccine bank where vaccines are stored for rapid delivery. One option for establishing a vaccine bank is contracting with a biologics company. This way, a specific number of doses of vaccine can be delivered when needed, or could be prepared and stored in your country. If your country chooses to have vaccines on hand, arrangements need to be made to ensure the vaccines are replaced before they expire. Another option is to work with other countries to establish a regional vaccine bank, or to request vaccines through international assistance programs. Another important and difficult aspect of avian influenza vaccination is the cold chain needed for vaccine storage and distribution. Currently, all vaccines for avian influenza need cold storage facilities in order to maintain the quality of the vaccine. Cold chain requirements include cold storage for vaccines prior to distribution, as the vaccine is distributed to the vaccinators and out in the field. Those who transport and use the vaccine must understand the importance of the cold chain and have the resources to maintain it. If vaccines are imported, arrangements must be made to ensure that they do not remain at airport customs without refrigeration. The current vaccines for H5N1 must all be injected individually. While the fowlpox vectored vaccine requires 1 dose, all other current H5N1 conventional vaccines require 2 doses. It takes several days after the second dose for the vaccines to be effective. The manufacturer's vaccination schedule and application recommendations should be followed, and the vaccines should be administered by trained vaccinators. The number of vaccines that should be ordered depends on both the number of poultry to be vaccinated and the capacity of the veterinary services to implement the vaccination program. After determining the number of birds that will be vaccinated, the order must provide for the number of doses per bird needed to induce effective immunity. In addition, birds with longer lifespans may need to be vaccinated again, and those doses should also be included. Another aspect of H5N1 vaccination is vaccination teams.
Vaccinators and paraveterinarians. And these, of course, are your most important people because these are the ones who will be going onto the farm to actually do the vaccination. And so this means you have a responsibility here to communicate with these people on what they're supposed to do. So they must be fully trained in vaccination. They need to understand aspects of cold chain, so how they're going to keep their vaccine cool during the day. They need to understand disease prevention. The last thing we want to see is for vaccinators to be spreading disease from farm to farm. And we know this has happened before with other disease control programs. So it's critical that these people are trained in the right methods and practical methods of disease prevention when they're moving from farm to farm. It's best to use hands-on training for this group, so they're actually out there with vaccination guns and vaccinating poultry, rather than trying to do it through videos.
Vaccination teams should include veterinarians, technicians, and assistants trained in both the vaccination procedure and the use of personal protective equipment, PPE, to shield themselves from exposure to avian influenza. Like vaccines, PPE should be stockpiled and available for use in emergency vaccination programs. PPE includes gloves, respirators or face masks, boots and coveralls, or other protective clothing. If possible, vaccination team members should receive a seasonal influenza vaccination. Antiviral drugs for prophylaxis should also be used if the vaccination team may be exposed to infected birds. Team members should be monitored for respiratory illnesses that occur within 7 days of their last exposure to potentially infected birds or contaminated materials. Vaccination team members should be trained in biosecurity measures to ensure they follow appropriate cleaning and disinfection procedures. Proper cleaning and disinfection minimizes any risk of teams spreading avian influenza viruses or other poultry pathogens between flocks. Team members must understand the importance of following the manufacturer's recommendations on the storage and delivery of the vaccine. They should also ensure that detailed records of vaccination are kept and entered in relevant databases so that the data is captured and can be used for future analysis. If at all possible, preliminary training exercises should be conducted with potential vaccination teams prior to initiating a vaccination program. Written or audiovisual materials that demonstrate use of PPE and importance of biosecurity practices can be developed in advance. Veterinary leaders can work with colleagues in other countries in their region to develop and share training materials for vaccination teams. The poultry industry in a country may take responsibility for administering vaccines to flocks that are maintained in closed facilities with high biosecurity. The industry staff can be trained about proper vaccine selection, administration, and monitoring while following the company's standard biosecurity procedures. A monitoring and surveillance program must be in place, and records should be shared with federal authorities for risk assessment and evaluation of vaccine efficacy. Farmers with smaller flocks can be given vaccine to use, but only if they have received adequate training in administration of the vaccine, understand the monitoring requirements, and agree to keep and share appropriate records. The poultry industry can also help with vaccination of village poultry. In one province in Egypt in January 2007, the private industry offered to vaccinate all the rural poultry sectors around it in order to protect itself. In summary, the major challenges are to ensure that vaccinators are properly trained and will use appropriate PPE, that they will follow vaccine handling, administration, and biosecurity procedures, and that they will keep adequate records. The vaccination campaign itself is a complex and important operation. Fighting a disease epidemic, or any other animal health emergency, is in many ways like fighting a fire. A coordinated approach is needed. While the official veterinary services are critical to the process, other agencies of government, such as finance, international border control, environment, public health, and emergency services must be closely involved for successful disease management. These agencies' involvement in development of the vaccination plan will help them better understand their roles and responsibilities when the campaign is implemented. During an outbreak situation and vaccination campaign, there may be immense communication challenges. An organized approach to communication can help meet these challenges. A well-defined chain of command and clear flow of information are very important for disease control operations. official veterinary services leaders must be able to make rapid decisions based on analysis of the best information available from all sources. They should then convert those decisions into clear orders. Veterinary managers must carry out the orders by communicating them to vaccination unit leaders, team managers, and team members. The unit leaders and team members should understand their responsibilities, recognize the command structure, and communicate back to the veterinary managers. Managers should in turn communicate to the official veterinary services. What is important is that the roles and responsibilities of each participant at each level in the response are clearly defined. Members of the vaccination team must have adequate equipment and technology for record-keeping and reporting responsibilities. An electronic disease information database can be a great asset in tracking the huge amount of data that can be accumulated during a disease epidemic. There are several systems available, including the FAO-designed and supported system, TAD-Info. Vaccination records should be kept by the competent authority. These records should include holdings, locations, and categories of animals, vaccine used, brand, batch numbers, number of doses, date of vaccination, total number of susceptible animals in holding, names of the operators who administered the vaccine, identification of vaccinated animals. Cultural practices will also impact the vaccination campaign. Cockfighting and gaming cocks have been directly implicated in the rapid spread of H5N1 in Asia. Prize cockfighting roosters are very valuable and are illegally transported across borders, sometimes from infected to uninfected areas. Reports indicate that this industry is using antivirals and vaccines without appropriate authority and documentation. The impact of cockfighting and illegal movement of birds should be taken into account in the management of the vaccination campaign. Vaccinated birds can still become infected and shed the virus, which can cause a silent transmission of the disease throughout a country. These infected flocks can be difficult to identify because they may not have clinical signs. If vaccination is used, it is important to be prepared for the monitoring program that accompanies vaccination. Vaccinated flocks should use marked unvaccinated sentinel birds or use a vaccine with a differentiating laboratory test. If the flocks become infected, the sentinel birds will become ill, and the infection will be detected. The benefit of using sentinel birds is that minimal laboratory testing is required. However, the drawback of this system is that the virus can replicate to high levels in the sentinels, contaminate the environment, and then spread. Using a vaccine with a differentiating laboratory test is called a DIVA strategy, differentiating infected from vaccinated animals. This requires a combination of a vaccine and diagnostic test. This strategy uses a vaccine that will induce antibody to the appropriate H protein, which is the important protective antibody. The vaccine is missing some component that is in the wild-type virus and induces antibody that is not important for protection. If the vaccinated birds become infected with the wild-type virus, they produce antibodies to the component that is not in the vaccine. The diagnostic test detects antibodies to the unimportant protein. If a bird is positive for that antibody, it means it has been infected with the wild-type virus. The flock is infected and should be destroyed. There are currently 3 types of DIVA systems. One that uses the conventional killed vaccines with the same H type as the field strain and a different N type from the field strain, for example an H5N2 vaccine. The companion DIVA test would test for antibodies against the N1 protein. If the vaccinated bird has antibody to N1, then it has been infected with the H5N1 virus. A second system, which uses the fowlpox recombinant vaccine, expressing the H5 protein. It only has the H5 antigen from the avian influenza virus. The companion DIVA test would test for antibodies to other influenza virus proteins, such as the N1, NS1, matrix, or nucleoprotein. Any bird with antibodies to those proteins must have been infected with the field virus. The third system uses the conventional killed vaccine for H5N1. These vaccines do not induce antibody to non-structural viral proteins. The DIVA test would detect antibodies to the non-structural proteins. There has been less experience with this system, and it is still being validated.
The other front which acts in the management of a vaccination campaign is, of course, the field. And here we have field veterinarians that are in charge of managing the infected flocks or the infected areas. They have to coordinate sampling activities and send the samples to the laboratory. And of course, they must perform clinical surveillance to see if there are any clinical indications that some disease is circulating in the vaccinated flocks. And I don't only mean influenza. As I said, if you have other viruses like immunosuppressive viruses, these can cause a lot more problems, and they require to be managed in the appropriate way. But all this information has to be fed back to the decision makers so that the decision makers can adjust the vaccination program and can adjust the monitoring program. And so it becomes a flexible system with inputs that generate changes or modifications so that slowly we can chase the virus out of the infected area and gain and reach the objective of eradication. It's not so much the vaccine you use, but it's the monitoring that really makes the difference.
Another component of the monitoring program is to determine vaccination compliance. Monitoring for vaccination compliance will give the veterinary authorities information on the level of protection in the population and insights into whether the vaccine is being administered properly. To implement a monitoring system, several factors have to be considered. First of all, the infrastructure needed to conduct laboratory tests should be available. This includes laboratory equipment and necessary reagents, qualified technical personnel, and quality control systems. Another prerequisite is that enough qualified field staff can visit farms and take samples. The samples should be transferred to the laboratory under cold conditions. Telephone, fax, data transfer systems, record keeping, and identification systems should be working properly. The record should indicate which farms have been visited, when they were visited, the location of the farms, the type of farm, the species involved, the dates of vaccination, and batch used. To monitor vaccination compliance, serum samples should be taken regularly to determine the level of vaccine-induced antibodies. The main purpose of monitoring is to detect virus circulation in a vaccinated population. This can be done by implementing one of the DIVA strategies. Targeted surveillance in high-risk places, such as live bird markets, can be considered for detection of virus circulation in an area or region. The monitoring programs are time-consuming, expensive, and must be continued as long as vaccination is used, but they are essential for success. As previously mentioned, awareness programs and planned communication strategies are needed throughout the vaccination program. In addition, a public education program for poultry producers should be implemented so that farmers and bird owners will support and cooperate with the vaccination, surveillance, and eradication program. Education within local communities can help facilitate mass vaccination programs. Leaders in local communities should be engaged, as they know the conditions in the area and can mobilize local resources for vaccination and surveillance. In addition, the general public should also be informed of all aspects of the avian influenza control program and should understand movement restriction regulations. Farmers and consumers should receive information on the routes of disease transmission and the risks of avian influenza, the time and place for vaccination, how producers can obtain compensation, better farming practices, and improved hygiene procedures. The public must be reassured that it is safe to eat healthy and vaccinated poultry during an outbreak. Although cooking will kill the influenza virus, infected birds and eggs from infected birds should not be eaten. In conclusion, vaccination can be an effective tool to aid in the control of H5N1 avian influenza, but must be used in conjunction with a surveillance and monitoring program and other management controls, biosecurity, and stamping out. Vaccination programs should be carefully planned and targeted to the population most at risk. After vaccination, samples must be continually collected and monitored to ensure that the program is working. A poorly planned and executed vaccination program can contribute to the spread and persistence of the H5N1 virus. Vaccination requires money, time, coordination between agencies, and continuous communication. The OIE, the FAO, and countries with experience in vaccination for H5N1 can provide additional advice on establishing and managing a vaccination campaign. This video series contains 3 other DVDs to assist government officials at different levels to provide advice and make decisions about vaccination for H5N1 highly pathogenic avian influenza. There are 16 presentations by avian influenza experts on various aspects of diagnosis, response, and recovery. There is also a DVD about diagnostic testing for H5N1 and a vaccine database available on the World Wide Web to assist in locating effective vaccines for H5N1.